Great.
So good evening, everybody. It's great to have you here with us. Hopefully we can answer a lot of your questions and we can share some of the survey results. For those that don't know, I'm Jamie Farr. I'm the superintendent of the Canandaigua City School District. Jeanie, would you like to introduce yourself?
Hi there, I'm Jeanie Grimm. I'm president of the Board of Education. Thanks for being with us tonight, everybody.
Thank you. So those of you who maybe are new to this, probably not many of you are, but if you are, just please hold any questions you have till the very end. We may answer some of those questions through the course of the presentation. I'll be doing the presentation, and when Jeanie feels inspired to chime in, she's more than welcome to, and she certainly will help me with the questions and answers at the end as well. You'll see me occasionally checking my cell phone. That's because we have a few folks out there that are watching and just letting me know if something doesn't come across clearly so we can restate it. And so that's really why I'll be doing that on occasion. But what I like to do is share my screen with a presentation for all of you to lead through this discussion. So I'll do that now. Jeanie, can you see the screen okay, the shared screen?
Thank you. Yep.
Okay, great. That means everybody should be able to then. So here we are with our community forum. And what we hope to discuss is our findings from the survey, the temperature check survey that we had discussed last week, and what our plan is moving forward. And we'll move through that as quickly as possible. So as you know, the New York State Department of Health released new guidance on reopening schools on April 9th. And so we've used that guidance to design our plans moving forward. But part of that guidance is we actually need to take the temperature of our community. What's their comfort level with moving from 6 feet to 3 feet before we can make any changes, because we need to change our reopening document and submit it to the state. And so we had to take the temperature of our community before we could do that. So what's some key information from there? First one I just mentioned, we needed to solicit your input, whether or not you're comfortable moving from 6 feet to 3 feet. We have to submit that plan. And I said to the state, what I didn't say is how many places we have to submit it. Our local Ontario County Public Health, we have to submit it there. The New York State Department of Health and the New York State Education Department. We also have to post it on our website. And so we make our new plan, when we develop our new plan, available on all those places. But in the guidance document, it really said that kids can be as little as 3 feet apart from one another with certain exceptions. And the exceptions is the next bullet point. For example, chorus, band, and physical education, now they must participate at 6 feet. Previously, it was 12 feet. So their restrictions lessened, but not all the way to 3 feet. And so they can participate at 6 feet. And then face masks must be worn at all time except for meals, except for when eating. The language around masks is a little stronger than what it was in the previous guidance document that was released in July, where they referenced mask breaks, or they referenced if you're greater than 6 feet apart, schools could determine whether or not students could take masks off. That language is gone now, and it specifically and clearly says you must wear masks at all time except for when eating. And so that's important to hear and to know. I am getting a little feedback that maybe my audio is a little choppy. I hope it's coming through well enough where people can understand what I'm saying, and I apologize for that. Moving on, so what would school look like? Over here on this side of the screen, we went through and we looked at what would the class sizes be based on the surveys that you all filled out a few weeks ago. What would class sizes be if we were to fully reopen 5 days a week? And you can see that. I won't read that list to you, but what I can tell you is for the primary through middle school, the classes would be a little bit larger than what we typically would have. The academy would be about normal from what we would typically have. But in the classrooms, you would see 3 feet of distancing. We would have 6 feet of distancing in lunch, utilizing flexible spaces throughout the buildings. Buses would have one child per seat where possible. It won't always be possible. About a third of our runs, based on the data that we have right now, would have 2 students per seat. Face masks would be worn at all times. Roof hatches and windows would be open when the weather permitted. 6 feet of distancing in music and physical education classrooms. Again, like I said, masks at all time. There was language that indicated that barriers, and I keep it on my desk just to use as an example, these types of barriers could be used, and we could use those barriers and be less than 6 feet. Language around that has been removed. And a lot of that has to do with the science with the transmission of COVID, that much of the transmission of COVID is happening through aerosols, through the air, and not on hard surfaces. And the barriers do very little to protect from the aerosols in the air. In fact, some research and some studies, depending on how they're positioned and how the room is set up, actually makes the airflow worse and contraction of COVID higher if it's not, if it's blocking airflow. And so that was an important change, and that did align with CDC. In fact, all these changes align very closely with the CDC, which was important. So moving forward with some other pieces you'll see in there, we still would have to do health screening, those morning health screenings with the questions, the questionnaire, and the temperature check. That still has to happen every day. And that just wanted to make everybody aware that breakfast and lunch is available to everybody free of charge. And that's a federal program. And it looks like that might be even extended into the next school year. So it's important to know. And then there are options for us to do voluntary randomized pool testing, COVID tests for students. We are, we're considering it. No decisions have been made on this at this point, but that is an option that was in the language that was worth noting. So again, the New York State Department of Health guidance document aligned very closely with the CDC, almost identical for the most part. And there's a link here. I shared this during the video I made last week. You can click the link. You can type in New York State, Ontario County, and it will tell you, are you rated high, substantial, moderate, or low? And what I can tell you right now is Ontario County is still in the high zone. We have right around 180 COVID cases total in the last 7 days. Good news, that's down from the previous week by almost 60 cases. It was in the 240s last week on that 7-day total, but it has to be under 100 for us to be able to move to 3 feet at the secondary levels. And secondary levels are middle school and academy and CACC here. And so that link is in the presentation. It's a public domain. Anybody can check it out and track progress. I will say as a disclaimer, our local data, so the public health in Ontario County is a little different than the CDC. Ontario County is up to the minute updated, whereas CDC might have a lag by a day or so, or perhaps even longer. And so we look at both pieces of data every Monday with the Ontario County Public Health and the CDC data. Here's our numbers. And it's becoming a little like an EKG chart, if I'm being honest. We see coming out of the holiday break, our numbers were at their peak. And we came down and we had some spikes and valleys here and there. We started to climb back up after February break, after the winter break. And we started to come back down, and then we hit spring break and we started to climb back up again. And a lot of that can be directly associated with kind of our behaviors during those timeframes. Are we socially gathering without masks, so forth and so on? Are we traveling out of state, perhaps not wearing masks out of state? We assist the public health in Ontario County with contact tracing. And oftentimes we can trace it back to where COVID was contracted. And what I can tell you, and even Ontario County Public Health will say, rarely is it happening here. That mostly it's happening through travel, in-home spread, things like that. I will also say, and this is more new information, I think the reason we see more of these peaks and valleys and EKG effect right now has a lot to do with, well, to be quite frank, with sports. What we're seeing through our data is that perhaps our athletes are reluctant to be forthcoming with their symptoms. Perhaps they think it's something else. Perhaps they don't want all their friends and their team to become quarantined, and so they're not as forthcoming, but they continue to come to practice or compete in games. Versus if they had a symptom and they were forthcoming right away, it would minimize quarantines. But because they're not, they're going to practice or games for a day, 2, 3, or 3 days, and exposing others. And then it's almost automatic from public health that the whole team then gets quarantined. We haven't had teams quarantined at all year long until of recent. And I think at this point, we've had 4 or 5 teams get quarantined for the very reason that I just explained. And so it's so important that people are taking their health screening surveys seriously. And if they have any symptoms, to seek the help right away and be forthcoming and honest, because that will keep, hopefully, their teammates moving and going and safe. But if they spread it amongst teammates, which a couple of the teams that were quarantined that happened with, those teammates go home, it spreads within their family, and it's just a cycle that it's hard to get out of. And so that's why we're seeing this kind of these spikes and valleys with the quarantines, especially, and a little bit of a rise in the rates. But because we're over 100 cases over 7 days, Ontario County is in the high zone. In fact, if you look at that CDC chart, almost all of New York State is. A couple counties and a couple regions have worked down below the high zone, but not many. And you can check that as much as you want. I know I check it all the time. But the reality is, if we're not under 100 cases over the course of 7 days, because we have 109,000 residents in Ontario County, for middle schools and high schools, we actually can't move from 6 feet to 3 feet. For elementary schools, we can, it's permitted, even if the infection rate is considered high. But for middle and high schools, it's not. And that's where we are right now. So we've put out there 2 different surveys. The original one was, if we were to open 5 days a week, what instructional model would you choose? What I can tell you is not many schools did that. If they moved from hybrid to in-person, the people that were in person, they moved to 5 days, and people weren't afforded the option to pick or choose. But we thought it was important to be of service to our community and to give you a voice and to say, if we made that change, who would want to make that change and either go 5 days of in-person or completely virtual? And people were allowed to pick back and forth either way. Our administrators then worked really hard with their counseling staff and other support staff that work on scheduling to build potential schedules and to see what it would look like and to see how disruptive it might be. And through their magic and through their really diligence and brilliance, they made it as less disruptive as possible. And I think I shared last time that, for example, in the primary elementary school, really only 12 students would change teachers, potentially at most, that didn't ask for a change. And that's impressive considering that building has about 15 or 1,600 students overall. And 12 was the most. It could have been less than that. And so great job to our folks that made that happen. The other survey was in response to the new guidance where we had to take the temperature. What's your level of tolerance from moving right now from 6 feet to 3 feet? We needed to ascertain that. Not every district did that. We did. We actually did do that. I can also share with you that not every district also asked their staff. We did. We wanted to know what our staff and our students felt. We wanted to know what our parents felt about that topic. And so we surveyed all of them. And we dug into that data. And so I'm going to share that data with you now because it is driving what we're going to do for the rest of the school year. Primary and elementary school, remember, I broke this out in primary and elementary school versus secondary, middle, high school, and CACC because of the language here in the transmission rates. It's different what we can do by those buildings. And so we broke the data out that way. But I will tell you the results of the data, no matter how we looked at it, if we looked at it all together, the results are the same. But we broke it out this way just for ease of explanation. At the primary and elementary school, 61% of the people surveyed said that they would like us to move to reopening as soon as possible before this school year is out. 39% of the people surveyed said, let's just status quo, let's stay where we are, finish the year out, and then focus on reopening fully in September. So the majority, 61%, wants the district to move forward with fully reopening. Now, contrary, in the middle school academy and CACC, 55%, the majority said stay in the current model we're in now. Finish the year as is, don't make any changes, and focus our efforts in September with that more full reopening. Whereas 44.5% said, let's fully reopen. And so the majority, albeit a little more slight, did say, let's stay as is. I will also say what kind of supports that majority in this is the fact that our infection rates are so high right now that we can't reopen anyway because we can't move from 6 feet to 3 feet. If anybody's kind of following the news and seeing what's happening, you're seeing that schools in Monroe County are doing just what we're talking about, where their primary and elementary schools are reopened, but they can't do so with their secondary schools because of that level of 100. They can't move below. And so that's the data. I'll show you that again. The primary elementary school, 61% in favor of reopening fully before the school year is open. At the secondary schools, and this includes also the CACC, the majority, 55.5, says stay as is. I want to also mention for the CACC, that's our alternative school that services around 40 students. They're going 4 days a week currently. and they're able to maintain 6 feet with all their students there. They are in discussions about whether or not they move to 5 days beyond instead of just the 4 days. And so there is potential they could move to 5 days, but the staff and that team is working through that right now. So moving along, what does this mean? What's our revised timeline? For the primary and elementary school, our plan is to reopen 5 days a week starting May 3rd. So it's about a week and a half from now, we will reopen our primary elementary school 5 days a week for those folks who selected in the first survey that they wanted their child to be in person 5 days a week. For the middle school, academy, and CACC, we will finish the year as is. We will not make any changes. They will finish in the hybrid or virtual format or 4-day format, whatever they're already in at this point. And our focus will turn to, with that group, on how can we open more fully in September. But I will say, if the New York State Department of Health guidance document doesn't change, let's project forward a little bit here. What really could happen is, as the infections go up and down, if they go up and down next year like they did this year, those secondary buildings might have to move from fully 5 days in person to hybrid, back to fully 5 days in person to hybrid. And that's difficult. That is challenging for families, for staff to plan for. I fully understand that. So hopefully some things will change with the guidance. Hopefully COVID will become more under control, and there's all kinds of mitigating efforts within the school, plus the vaccination and things like that. Hopefully we'll be in a different place next year, but it's really hard to tell at this point. So let's talk about virtual students. If you've selected to be a virtual student at the primary elementary school, starting on May 3rd, that virtual synchronous instruction will move to 5 days a week. Currently, it's 4 days a week, and Wednesdays is an asynchronous day. So what will happen is it'll move to 5 days a week, synchronous virtual instruction. At the middle school, academy, and CACC, for the virtual students, your virtual instruction will remain the same. You'll have the 4 days of synchronous instruction, and then Wednesdays will be asynchronous instruction. So why now? People have asked, why would we do this now? And this visual is purposeful for a number of reasons. But the tallest arrow is the social emotional piece. We know students are struggling mentally and emotionally, and the reality is we have a fantastic team of counselors, social workers, prevention specialists. We just have, you name it. We have really strong SEL support staff here for the mental health team, and bringing them back, we can provide them ongoing support that they need to process everything that they've been through over the course of the last year. And so that's the number one priority. That's why that arrow is the largest. That's our focus right now, and our number one priority for our students at the primary elementary school, and of course at the secondary schools as well. But why are we making this change right now at the primary elementary school? Also, reacclimation. It's been over a year since we've been in school fully. And thinking about our UPK students, our kindergarten students, and our first graders, some of those students, they don't know, they don't remember, but they certainly don't know what a full year of normal school is like. Because the first graders, when they're in kindergarten, their year was cut short. The UPK students, their year was cut short. And our current UPK students, this is all they've ever known. And so we need to reacclimate folks, and we need to kind of build that stamina for school and what school is. It's what we do. Also build community. The sense of community is so integral here in Canandaigua, and it's something we believe in and we rally around. And that's been missing. It truly has been missing, other than virtual community, which is, a lot of Zoom and things like that. And we try to build community as much as we can. And there's aspects of community rallying to support one another, but it's not what we envision when we think about Canandaigua and education. And so we need to rebuild community here in school. And part of that community is relationships. It's really to establish and build and foster those relationships that are integral with students, with parents, so forth and so on, and community partners. We need to prepare for September. Having 6 or 7 weeks of full in-person instruction at the primary elementary school will afford us ability to learn and to prepare even more fully for September, and to iron out any of the wrinkles that might exist. And then academic recovery. I purposely put that one last because and the smallest arrow, because what I don't want people thinking is, oh, we're fully reopened, let's recover all this academic loss right now. It won't happen that way. There's transitions are tough and they take time and they need to be done thoughtfully. And so while academics are important and we will focus on that, and our staff is fantastic with this, that's kind of secondary right now. It's really about this other stuff that we are focusing our energies on. And I'm not at all saying that academics won't happen, so please don't read it that way. But there's other priorities that are important as well, and more important in my opinion. And so really, I know this is a polarizing topic, but at the same time, in my opinion, this is to be celebrated. We've been through a really difficult year. Difficult's probably putting it lightly. And we've gotten to this point where maybe we're taking another step to put this time behind us. Yes, we're going to learn from this time. Yes, things are going to change because of what we've just experienced fundamentally. But can we start moving back to or towards and taking the positives from this experience and being better as a result of it back towards our normal? And I don't use the word normal to be offensive. It's more symbolic, getting back to what we envision school as being, as a place where we celebrate, where we care, where we love, where we educate. Can we get back to that more fully? But really, it's because of all these people, our Board of Education, our leadership team, our staff, students, parents, guardians, community partners. We've made it this far because of you. And what I can say is, and I truly believe this, I believe that we've been very thoughtful through this process. We're not rushing it just for the sake of rushing it. We want to be prepared and we want to do it right. And we want to learn from others. And so that's kind of the approach we've taken. And so I know I've gone through that presentation fairly quickly, which is what I hope to do. And now what I'll do is stop sharing my screen and we'll start looking.